Hey everyone, it's Muthukumar. Kidney stones, just the name sends shivers down your spine. They can be incredibly painful, but the good news is, with the right approach, you can recover and even prevent future stones from forming. Whether you're currently dealing with a kidney stone or just want to be prepared, this video is for you. We'll go through everything you need to know, from managing the pain to making lifestyle changes that will help you stay stone-free in the long run. So if you're ready to take control of your kidney health, grab a glass of water, hydration is key, and let's dive into this comprehensive guide on how to manage and recover from kidney stones. First things first, let's talk about managing the pain. Kidney stones are notorious for causing intense discomfort, but over-the-counter pain relievers can be your best friend during this time. Ibuprofen, which you might know as Advil or acetaminophen, also known as Tylenol, can provide effective relief. Now remember, I'm sharing general advice here, but it's crucial to talk to your doctor or pharmacist before taking any new medications, even over-the-counter ones. They can make sure the medication is right for you based on your medical history and any other medications you might be taking. And if the pain is severe or unbearable, don't hesitate to reach out to a medical professional immediately. There might be other treatment options available to provide faster relief. Now let's talk about hydration. When it comes to kidney stones, water is truly your best friend. Think of it as your body's natural way to flush out those pesky stones. Aim to drink at least 8 to 10 glasses of water throughout the day. And it's not just about the quantity, but the frequency too. Sip on water consistently throughout the day. Don't just chug a large amount at once. Think of it like this. You're creating a steady stream to help those stones move along. Remember, staying hydrated is not just important for recovery, but also for preventing future stones. While water should be your go-to, you can also increase your fluid intake with other beverages. Think clear broths, herbal teas, and even diluted fruit juices. The key here is to choose drinks that are low in sugar and sodium, as these can actually contribute to stone formation. One of my favorite refreshing options is a simple mix of water with a squeeze of lemon. Lemons contain citrate, which can help break down calcium-based kidney stones, which are the most common type. Remember, every little bit counts, so make sure you're getting enough fluids throughout the day. Now let's talk about diet. Certain foods are known to contribute to kidney stone formation, and one of the main culprits is oxalate. Oxalate is a naturally occurring compound found in many foods, and while it's generally not a concern, if you're prone to kidney stones, you might want to watch your intake. Some common high-oxalate foods include chocolate, spinach, nuts, and even tea. Now, I'm not saying you need to completely eliminate these foods from your diet, but moderation is key. If you're enjoying a spinach salad for lunch, try to balance it out with low-oxalate foods for dinner like bell peppers, cucumbers, or cauliflower. Now let's talk about a supplement that can be helpful in preventing kidney stones, potassium citrate. Potassium citrate works by binding to calcium in your urine, making it less likely to form stones. It's important to note that potassium citrate is not a magic cure and it's not for everyone. It's essential to talk to your doctor before starting any new supplement, including potassium citrate. They can assess your individual needs and determine if it's right for you. They can also advise you on the correct dosage and monitor for any potential side effects. Regular checkups are crucial for overall health, and when it comes to kidney stones, urine tests can be incredibly valuable. These tests can help monitor your progress, detect any new stones early on, and identify any underlying conditions that might be contributing to stone formation. Your doctor might recommend urine tests at different intervals depending on your individual situation. It's important to follow their recommendations and attend all scheduled appointments. Early detection is key when it comes to managing kidney stones, and urine tests play a vital role in that process. Chapter 7. Hydration, your lifelong habit for healthy kidneys. We've talked about hydration throughout this video, and for a good reason. Staying hydrated is one of the most effective ways to prevent kidney stones from forming in the first place. Make it a habit to drink water consistently throughout the day, every day. Carry a reusable water bottle with you as a reminder, and make healthy swaps like choosing water over sugary drinks. You can even set reminders on your phone to ensure you're taking regular sips. Remember, hydration is not a temporary fix, but a lifelong habit for healthy kidneys. Chapter 8. Severe pain, seek help immediately. While some kidney stones can pass on their own with minimal discomfort, others can cause severe pain that requires immediate medical attention. If you're experiencing intense pain that's not relieved by over-the-counter medication, don't wait it out. Other warning signs that warrant immediate medical attention include blood in your urine, fever, chills, nausea, or vomiting. These could be signs of a larger stone or an infection. Remember, it's always better to err on the side of caution when it comes to your health. Chapter 9. Recovery time. Every stone tells a different story. Recovery time for kidney stones can vary greatly depending on the size and location of the stone. Smaller stones may pass relatively quickly with minimal intervention, while larger stones might require more time and medical procedures. Your doctor will be able to give you a more accurate estimate of your recovery time based on your individual situation. It's important to follow their instructions carefully and be patient with your body as it heals. Chapter 10. Patience and Persistence. Your keys to recovery. Recovering from kidney stones is a journey, and like any journey, it requires patience and persistence. There might be ups and downs along the way, but remember that you're taking steps towards better health. Follow your doctor's recommendations, make healthy lifestyle changes, and don't hesitate to reach out for support when you need it. You've got this. Outro: stay hydrated, stay healthy. So there you have it, your ultimate guide to kidney stone recovery. Remember, recovering from kidney stones is a process that involves medical treatment, lifestyle changes, and dietary modifications. Stay proactive in your health journey, and don't hesitate to reach out to your healthcare provider for personalized advice. Remember, every individual is different, and what works for one person might not work for another. Your doctor can help you create a personalized plan that addresses your specific needs and concerns. Stay healthy and hydrated, and as always, thanks for watching.